Hello, ladies and gentlemen. In this video, I'd like to talk a little bit about the various SMART-on-FHIR app launch options. Here on the HL7 page, we see that there are these two patterns for client authorization. There's the Smart App Launch and the Smart Backend Services. We'll discuss the backend services in another video, and in this video, we'll talk about the Smart App Launch, which there are 4 use cases described. There are patient apps that launch standalone, such as in a standalone browser. There's patient apps that launch directly from the patient portal, provider or clinician apps that launch standalone, and provider or clinician apps that launch from the EHR. If you're wondering what's the difference between a patient app and a provider app, well, essentially, providers should be able to do more things than patients can do. Patients should be able to look at their own medical data, but maybe they shouldn't be able to make changes to their data. For instance, maybe they shouldn't be able to prescribe medications to themselves, which is something that a provider would be able to do. And there's the difference between standalone and portal or standalone and EHR is a matter of convenience. You may want to build an app that is launched directly from the EHR because the workflow involves the provider working in the EHR and then launching your app. I've built this table here to test out the different workflows, and this will be available in the Plasma-FHIR framework. So here I'm using the Smart Health IT Sandbox, and I've also got some Epic options as well. And I'll show you what each workflow would look like. So for the patient standalone, that would be maybe you navigate to a website and you click on this button and this launches a company's patient app. And so what it would do is it would authenticate you based on your patient portal credentials. So if you're using an Epic Health system, you would authenticate yourself using your MyChart credentials. And I'll show you what that would look like. So I'm going to use the Epic Sandbox. This is fake data. And what we're going to do is we're going to launch this sandbox, and it's going to ask us to log in using our MyChart credentials. So I've written some usernames and passwords here. And then once we've authenticated, it'll navigate us back to our app. So let's see how that would look. Okay, so I've launched the app and now I'm redirected to the MyChart login page. And I've already got the credentials saved, so I'm going to go ahead and sign in. It'll give me some warning messages and it'll tell me what FHIR resources this app has access to. So I'll go ahead and continue through those. And then I'll be navigated back to my app, in which case it's the Plasma portal. And I can see the patient's name, birthday, address. I could add more medical data on there if I'd like. So that's the patient standalone launch. The clinician or provider standalone launch is essentially the same, so I'm not going to show it. And so let's go on to the patient portal launch. In this case, we'll use the Smart Health IT Sandbox because they already provide an app launcher that makes this a lot easier. So what we're going to do here is follow these instructions. We're going to open the Smart App Launcher. We're going to select Patient Portal Launch. And what we'll do here is we will copy and paste the URL that we want to be directed to down here. And then the way that the Smart Health IT has it set up is the login is actually the patient's ID. So we'll copy that, and then I will click Launch App, and we'll paste in the patient's ID, which is their login, and you can use anything for a password. And this simulates if you were in the patient portal right here, and then it's actually hosting your patient-facing app inside of it. Okay. And lastly, and perhaps more interestingly, is the EHR hosted launch. So it works pretty much the same way. We're going to copy and paste the URL of our app that we want to actually host within the EHR. And we'll once again use the Smart App Launcher. And in this case, we'll click Provider EHR Launch. And this is going to simulate a launch within the EHR. So think about a clinician working on the EHR, such as Epic, and he clicks a button, he or she clicks a button, and it launches your app directly within the EHR. Okay? So we'll do the same thing. We'll paste the URL for our app. In my case, I'm hosting it locally, but that wouldn't normally be the case. We'll launch the app. And now we're brought up with a patient selector. I could select any patient. Remember, providers have the ability to look at the medical data for multiple patients. And now I've got the patient portal, which is the app, the sample app that I've created, and it's actually hosted within this EHR. So think of this as the Epic EHR is hosting your app. And I would like to mention that if the provider already had a patient open when they launched this app, then he or she wouldn't need to reselect that patient. It would automatically open to that patient. Okay, so that's just a quick review of the 4 different use cases for the SMART-on-FHIR app launch framework. And if you want to test it out, this table will be available in the Plasma-FHIR framework, and you can test it out on the various different sandboxes. I have Smart Health IT, Epic. I'm actually still developing this, so it'll be done soon. And then I actually have instructions for you to test it on a live Epic client. So if you're a MyChart user, you can actually launch this and log into your actual MyChart account and test that out. If you have any questions, please leave them in the comments below. And if you like these kind of videos, then subscribe to be notified of future updates. Thanks for watching.